Test position. Sitting up tall. We're going to bring the individual out into a flexion at 90 degrees like this with the elbow at 90 degrees. All right. Support right here. This is a passive test. Most special tests are a lot of them. Now all I'm going to do is grab hold right here just above the wrist and I'm going to pull into internal rotation like this.
Oh, okay. You're getting your response.
Okay.
Yeah, she's laughing.
Where are your shoulders? Okay. So she's localizing something out here just underneath the delta.
Let's have her throw.
What?
Let's have her throw.
Let's have her
Somebody
throw.
irritates her.
Okay, so that's all we have to do for that test. A positive sign again is a pain. Okay? Reproduction of their synthesis. A near test, also testing for intimate, but primarily of things like the long head of the biceps tendon. Bring her into elbow extension, flexion posture right here. Turn her into full internal rotation like this. Grab a hold of her scapula, and then just move her up like this, passively.
How much pressure are you applying to the scapula? Or
I'm just trying to keep it from going really far. I don't want it to go wherever it wants to. What I'm mostly doing is keeping her body from going. So just firm pressure.
okay.
I'm not trying to block her scapula.
Okay.
Just right there. And just bring her up like this. Okay? So if I push forward on her scapula and backward on her arm like that, I'm jamming things together up there. And if there's something that's going to be sore, it'll provoke it. Okay? So we got a Hawkins-Kennedy kind of positive, right? But we got a negative near. So those tested slightly different structures. So then the other one we can do is open can. What does it test for? Supraspinatus. So we want to make sure that we do this one in a scaption plane. So we bring it up to about 90 degrees of flexion, and then pull it out into a horizontal abduction so that she's out here about 45 degrees. The thumb is pointed down, which is a fully internally rotated position, and then we support her. And I say, I'm going to take my hand away. I want you to keep your arm there. Don't let it drop. And she can support that. But what are we asking for? We're looking for two different things. What's a positive sign?
If she can't hold it.
Okay, number one, she can't hold it. Or two, complain of pain, or the combination of those two. There's a test actually for rotator cuff. It's this, called a drop arm test. And we do the same thing out here, and then let go. And if they have a rotator cuff, we can still do this drop down. So that's an open can test specifically for supraspinatus, or empty can. Because you're emptying a can.
Is there like a time limit where they can hold it and then they drop it?
No, you don't make them stay out there for really long because it gets tired and starts to fatigue. If there is supraspinatus tendon involvement, you'll see it within just a few seconds. So I wouldn't keep them out there for any more than about 4 or 5 seconds like that. And then, like I say, if I'm equivocal or I want to just give them some extra pressure, I say hold on and push it down and see what happens. So 4 or 5 seconds is enough time. Okay?